Habib Davanloo. In our series of FAQ psychoanalysis, we come to the last psychoanalytic thinker that we are going to cover in this series. I had said by mistake that this book contains a chapter on Eastern schools of psychotherapy, Eastern models of the mind. It was a mistake. This book I went through again does not have any chapter on Eastern models of the mind or psychotherapy. That chapter is in another book of mine titled Dream Analysis. So that stands corrected. Today we'll reflect upon rather the chapter on Habib Davanloo. Habib Davanloo is fortunately for all of us alive and strong, going strong. Habib Davanloo created the school of psychotherapy called ISTDP, Intensive Short-Term Dynamic Psychotherapy. He's based out of Canada, holds his annual seminars there. ISTDP is a unique school of psychotherapy. It is based on psychoanalysis, on the concept of the unconscious, concept of primacy of the, it's based upon first existence of the unconscious, primacy of the unconscious, the pathology being determined by entities in the unconscious mind. So Davanloo does not reject what Freud says, what Klein says, or what Bion says. He does seem to implicitly reject what Kohut says, because this therapy is an intense therapy and short-term therapy. In the history of therapy, there always has been a quest for a therapy which is quick, structured, and predictable. Mind is so complex and pathology is such a complex entity that till now, even today, such an ideal therapy has eluded us. It has been beyond our capability to create such an ideal therapy, which is quick, which is deep, which is structured, which is predictable, and which does not have relapse. Davanloo was frustrated with the slow movement of classical psychoanalysis. He was also frustrated with the amorphous, unstructured nature of psychoanalysis. He was also frustrated with the different schools of psychoanalysis, which is so difficult to integrate and bring together. And during the course of his therapy, he noticed certain things. He noticed repeatedly when a person is mobilized for real, deep, meaningful change and work, I should say work and change, the person often sighs, gives a deep sigh. Similarly, when a person is confronted with the real affect which is blocked in the conflict, there is a heightening of resistance. And after the resistance goes high, it drops down. But while it's going high, it's the therapy room situation seems very precarious. And there is always the danger of the person terminating the therapy or the therapy becoming a battleground for the two instead of being the battleground with the pathology. Davanloo also realized that deep-seated murderous and torturous rage and fantasies related to them and guilt related to having such fantasies is in the unconscious mind, and this is almost a new line of pathology. I would call it Davanloo's line of pathology. So just as there is a drive school line of pathology, individuation Jungian school line of pathology, Kleinian school line of pathology, Ocean self-psychology line of pathology. The fifth line I would put would be the Davanloo's ISTDP line of pathology. It is not a question of or, it's a question of and. That all these lines of pathologies exist, and in different people we find some more and some less. ISTDP therefore looks like a miracle cure and ideal therapy that we were all in search for, but that is not the case. Like all other therapies, ISTDP also has its strengths and limitations. It works very well with certain sets of patients in certain situations, not a universally equally efficacious therapy. Every therapy followers, essentially, when you look at strong followers, staunch followers of any therapy, you see the search for omnipotence at work. That in the unconscious, there is a search for omnipotence, and there is a search that I should get one omnipotent tool, one omnipotent therapy, which is omnipotent and can heal everything and anything efficaciously. In that sense, many followers of each school, including ISTDP, become narcissistic, self-righteous, and they live out their search for omnipotence by investing omnipotence in the therapy they practice. It is true for all therapies. It is true for ISTDP also, that the practitioners often are found to be self-righteous, narcissistic, fanatic, closed, and driven by their own search of omnipotence, which they have projected into the therapy or the school. However, ISTDP is a wonderful technique innovation. It's not so much of a conceptual innovation. The conceptual innovation essentially is just the Davanloo's line of pathology. That is the conceptual evolution, which is small, which is not very big. It's precious, valuable, innovative, but it is not something which is, Davanloo has not created a model of the mind or reinterpreted what Freud and Klein said in some other way. So we don't see a wide enterprise of conceptual nature. Conceptually, there is this innovation, very precious innovation, no doubt, about this one extra line of pathology. But essentially, ISTDP is a technique innovation. And Davanloo wanted it to be as theoretical as possible, but it has not been able to be theoretical for long. And different schools of psychoanalysis have already entered ISTDP, which ISTDP practitioners find it very difficult to accept, know, and even more difficult to acknowledge. So it's no longer theoretical. Freud has already entered into it. Klein has entered into it. OSHO has entered into it in case of fragile patients. So these classical therapies are already into it. But what is more interesting in ISTDP is that it video records the sessions, and therefore that brings a very different quality to empirical research, empirical proving, and supervision, because nothing can substitute a video in terms of the data. So ISTDP sessions are videotaped for supervision and for research and for teaching. ISTDP as a therapy also has some flaws, but the flaws are so deep-rooted that very few people, unless they have very deep intellectual depth and width in psychoanalysis, can point out those flaws. And like good thought structures, ISTDP also is a very good thought structure which has become internally consistent and which has become difficult to find fault with kind of structure. Unless you are really very deep into psychoanalysis conceptually, you will get lost into ISTDP, including its flaws. And that is trouble, because that is true of all schools of psychoanalysis, that they are so elaborate, so deep, and so internally consistent. And this internal consistency, if you look into it, comes often when a school which is open, not yet complete, is closed by its followers to become a complete school so as to have internal consistency. So internal consistency arises not because of the accuracy of the school, but because the school was created in a way, the closure of the openness of the school was achieved in a way so as to ensure consistency, internal consistency and comprehensiveness. So that flaw of theory building also is in ISTDP. It's very deep to find out the flaws in ISTDP, and it's very easy to get lost in what appears to be a comprehensive and an internally consistent system, which it is not. It's neither comprehensive nor internally consistent. But the flaws are difficult to detect. One of the videos I have put on this channel goes into those difficult to detect limitations of ISTP. So it's a wonderful innovation. ISTDP is a wonderful technique innovation, but it's a prematurely over-marketed innovation. So I am both an admirer and a critic of ISTDP, and I believe ISTDP is a great innovation, and in future it will enrich all other schools of psychoanalysis in terms of the technique and in terms of how they try to walk past the points where they get stuck. Often it happens in Freudian therapy or Clydean therapy that conceptually it is very clear what to do, but people get stuck. The affect just does not come out. Intellectually everything is understood, but affect does not come out. ISTDP is a wonderful technique of catharsis. It's a wonderful technique of catharsis. How to enable catharsis. And with catharsis, the whole idea is to move towards a fundamental restructuring for health. So there are two ways out. One, in future, ISTDP can get enriched with theories coming from all the classical schools and become a more comprehensive school, which is less likely because it's like a technique-driven school trying to integrate conceptual schools into itself. More likely is that these innovations will get absorbed by individual schools to enhance their own technique. So this is where the future seems to go, either of the two. ISTDP becoming an all-integrating school is less likely in probability compared to other schools integrating ISTDP. Those who like ISTDP but find limitations of ISTDP and wish to overcome it in a creative way have created a completely new arena of EDT, experiential dynamic therapy, which are based foundationally on ISTDP, which in turn is based foundationally on psychoanalysis. And EDT practitioners have creatively used ISTDP and its fundamentals in far more creative way and often in conjunction with other schools of psychoanalysis. ISTDP also has one interesting characteristic which parallels hypnotherapy. In hypnotherapy, what happened was it started off with being a limited core technique, but thereafter they realized that in the state of hypnosis, you can use insights from other schools of therapy, both cognitive schools, behavioral schools, as well as psychoanalytic schools. You can take tools and insights from any school and use it in the state of hypnosis. They found the effect to be slightly better in their opinion. We are therefore looking here at a situation of two entities at work, a state and tools, creating the state which is most conducive for change, and after creating that state, using the tools of that school. So in hypnosis, we would create a state of hypnosis and then use tools of hypnotherapy. Hypnotherapy developed further to say it would create the state and then use tools of not only hypnotherapy but of CBT, CT, as well as psychoanalysis. So as hypnotherapy developed, what happened was the state creation remained the same, but the tools to be used after creating the state, which was more facilitating to healing, all tools from all schools were used after creating the state. ISTDP is moving on a similar line. It creates a state of crisis for healing, and once having created that state, tools are used from many schools of therapy. Not only in terms of after creating the crisis, but even before the state of crisis is created, tools from CBT, from acceptance commitment therapy, from Kleinian school, from Ocean school are being used. So ISTDP is emerging as one of a very integrated schools which is using tools and insights from many schools. And if we go into this whole area of therapy, we find there are therapies which create state and then use their insights and tools after creating a state which they feel is more conducive to health, to change for the health, for healing. And there are psychotherapy schools which are not so much into state creation. It is a very interesting area in psychotherapy. Therapies which are state-based, which create a state and then operate their tools and insights, and therapies which are not state-based. One of my lectures on the channel is on this topic, state of change, in which I have elaborated on therapies which are state-based and therapies which are not state-based. ISTDP is one of the state-based therapies. It creates a state, and in that state then operates its tools. So let us go into ISTDP. Questions on the chapter. Question 1. Who is Dr. Habib Davanloo? He is a psychoanalyst trained in classical psychoanalysis, later created ISTDP, based out of Montreal, Canada, where he holds his annual seminars. What is Dr. Davanloo's contribution to psychoanalysis? He has addressed a critical need in psychoanalysis in terms of a technique innovation of how to facilitate catharsis and thereby gain an entry into that part of the mind where fundamental restructuring can happen. So the healing here happens in two ways. First, by confrontation and challenge. Catharsis is brought about in a transferential way usually, or in then and there as the case may be. In catharsis, the focus is on anger, pain, and guilt. These are the three primary effects on which the focus of this therapy is. And the whole idea is to feel them fully in the body with all the sensations that accompany the feeling of this affect in the body and let it go. And this feeling and expression of affect not only facilitates catharsis, but also opens up a large and unrestricted entry into the unconscious for fundamental restructuring and fundamental rising up of repressed material. This technique innovation is something very new, and I think in terms of technique, it is the most fundamental technique innovation in psychoanalysis after Kohut. So Freud was the first, Kohut was second, and Davanloo is the third, if you look at the radical nature of the technique innovation. Conceptually, Davanloo's line of pathology is a fundamental new conceptual contribution to psychoanalysis. So the contributions are two. Conceptually, the contribution is in terms of Davanloo's line of pathology, and technique-wise, the real innovation and real contribution to psychoanalysis is in terms of technique, of entering, getting almost a wholesale entry into the unconscious, ensuring catharsis and restructuring. Third, what is the basic concept behind this approach? Conceptually, there are two fundamental pillars of Davanloo's approach. Conceptual pillar is that he starts with Bowlby's attachment theory, that human beings intrinsically are loving and attaching creatures and desiring creatures. So we are desiring, loving, and attaching creatures. DLA. So we are essentially desiring, loving, and attaching creatures, and we attach ourselves, we love our parents, we attach to our parents, and we desire everything from them. When our desires and expectations and our approach of love and attachment is not reciprocated well, but frustrated, we feel intense rage towards the parents. The rage has two parts to it: a murderous rage to kill the parents, and a torturous rage to torture them before killing it. And the torturous rage often is repressed deeper than the murderous rage. At times it can be above the murderous rage also. And because we have murderous and torturous rage towards the parents, there is a guilt for harboring these ideas and feelings towards the parents, because love and attachment also is towards the same parents, and the same parents, while they don't fulfill all our desires, are fulfilling many of our desires. So there is intense guilt, and this guilt becomes self-punishing, and the guilt creates a secondary rage towards oneself, which becomes self-destructive. And this rage can lead to our self-sabotaging ourselves, self-sabotaging our professional life, self-sabotaging our personal life, even creating psychosomatic sicknesses, even leading to so-called accidents, which actually are engineered by a punitive guilt. So the way out, and this is Davanloo's conceptual line of pathology, and the way out, therefore, is to feel fully the rage, the murderous rage and torturous rage towards the parents in the body. Feel fully the guilt also in the body, including the body, fully meaning including the body. And once the guilt is felt, rage is felt, guilt is felt, then pain is felt, and then love is felt. So after anger, guilt, and pain, the positive feelings come up. The positive feelings of love and the desire to attach, and the desire to take care and have concern for. And with this, fundamental restructuring becomes possible. So the whole technique is to put pressure, make it short and intensive, and feel this rage, guilt, pain, thereafter love, concern, care, and thereafter be ready for another healthy attachment. The movement and all of this is repressed, and there is resistance naturally to that which is repressed. So when a person is asked and taken in that direction, there is confrontation, resistance. The resistance rises very high in confrontation. It almost appears as though one is near to fighting with the patient, and then the resistance drops, and a sudden and a wholesale access to the unconscious becomes possible. So the resistance rises and it falls. It's a steep rise and a steep fall. The fall actually is even more steep than the rise. This murderous and torturous rage some people feel directly, recollecting some event involving the parents, or it may be felt transferentially with the therapist. The person may have brutal ideas and feelings in imagination towards the therapist, and often in technique what is done is, after the murderous and torturous rage is enacted in imagination called portrayal, the person is taken to inspect the dead body, the tortured body, and look into the eyes if they are there, and if they are not there, the therapist asks the person to put back the eyes which were taken off in torture and look into the eyes. And often that is the point of shift from the dead body of the therapist, tortured body of the therapist. One starts seeing the dead body of the parents and realizes that it was done in transference. Not knowing the word transference, but essentially they realize this movement happening. So the transference often ends and the real thing starts after looking into the eyes of the person. What is ISTDP all about? It is about doing psychotherapy in an intensive way in a short period of time. It is a structured therapy, and the number of sessions required in general from experience is that for mild cases, it is 5 sessions. Mild to moderate, it is up to 15 sessions, and 15 to 25 sessions. And in fragile cases or very deep-seated cases, it may go up to 150 sessions. It is still far less than conventional therapy. However, if you look at the fragile or the deep cases of personality disorders, of psychosis, some cases of borderline, then it is neither deep nor intensive. It is deep, but it's neither short nor intensive. Because 150 sessions would be almost 2 years. That is neither short nor intensive. And for fragile patients, you cannot be intensive. You have to get into the cohesion holding mode. 5. What are the 3 phases in general of ISTD? The general phases are, first is the phase of pressure, then challenge, and then if necessary, head-on collision. Head-on collision has to be selectively done. It can easily backfire if done on certain patients who are not cut out for it, especially fragile patients or narcissistic patients. So the first is the phase of pressure. To define a problem, first start with the articulation of a problem, do the cost-benefit analysis of the problem, have the will of the person to go deep into the problem, and then recollect an event of the problem and then put pressure to recollect the feelings related to somebody involved in that event. This is the first phase of starting off and pressure. The second phase is of clarification of defense and management of anxiety. And the third phase can be sustained pressure or head-on collision as the need may be. So, patients who are with a strong ego, not fragile patients, not with very deep depression, not with florid psychosis, not with those who want a wider engagement with life. Except for those patients, the technique would work. Technique would not work in deeply depressed people, in florid psychosis, in fragile patients. For fragile patients, the technique has to be modified, and the modification makes it neither short nor intensive. The cohesion holding indirectly comes in. Sixth, how does ISTDP compare with psychoanalysis in terms of efficacy and relapse? Studies have shown that it has better efficacy in terms of quick healing and lower rate of relapse where healing has happened. That does not mean all those who come to psychoanalysis can be benefited from ISTDP. It works well with certain groups of patients, does not work well with certain groups of patients. Many patients will tell you that they don't like this technique at all, and they would like you to follow another route. And then you have two choices. Either you say, I do only this, in which case most of the times you lose the patient, or you modify your technique and make it more eclectic. Instead of pure ISTDP, you can go into ISTDP informed. Is ISTDP applicable to all disorders with good efficacy? No. It is applicable to a large section of disorders, but is not effective in case of extreme borderline cases, psychotic cases, deep depression, extremely narcissistic cases, or cases where the individual feels it is too monotonous, restrictive, and boring, who wants a wider engagement with life, who wants to travel the world of the mind more widely than just be focused on this theoretical, standardized, monotonous approach. So if somebody wants to explore his dreams, explore how to enhance his life in a positive sense. He would not like to put all time into catharsis and pressure to feel anger, pain, and guilt. So that group, which wants a wider travel of the mind and life, who are looking for self-growth, not only healing through catharsis, they don't fit into the ISTDP framework. So there are many who feel it is very restrictive, very narrow, very monotonous, and too confrontational, not to their taste. So that group does not like ISTDP. They go for other forms of therapy. Those who like Jungian therapy are the most away from ISTDP. Those who like Ocean therapy are most away from ISTDP. Those who like Lacanian therapy are most away from ISTDP. One commonality Lacanian therapy shares is the concept of variable session to keep the intensity. So if the variable session is used in the Lacanian form, then it becomes intense, and that intensity is shared with ISTDP in terms of just the intent and the intensity of self-exploration, but not in terms of the wholesale catharsis that ISTDP wants or aims at. 9. What is the normal process of healing in ISTDP? The focus on feeling is relentless. The work on defenses which don't allow the flow of affect is relentless. Anxiety regulation is very important. When anxiety rises very high in response to the feelings coming up, and the final objective is to overcome, is to develop capacity so that anxiety does not rise high, overcome the defenses which are resisting, and feel the feelings fully, especially anger, pain, and guilt. Feel it fully in the body. Get into a portrayal, into an imaginative drama, which is called portrayal, of unleashing loose one's murderous and torturous rage on somebody, usually the parents or a parent substitute or somebody in transference, including the therapist, and then move from anger, pain, and guilt to love, care, attachment, and restructuring. So what is collected in the past, that negative effect is catharted out, and by restructuring we ensure the negative effect is not recreated. And that is where the relapse does not happen. If the catharsis happens but the restructuring does not happen, relapse will happen. The whole idea here is to not only unleash the feeling of affect, but to make it move into the striated muscles of hands and legs. So the idea is that in childhood and by nature, the whole flow of affect is from wherever it is generated into hands and legs. And I'm referring to the effect of anger. So anger, if it is generated, wherever it is generated, it has to flow into hands and legs, because aggression is meant to flow into the two limbs, two pairs of limbs, because that is where the fight and flight has to biologically operate. So this natural path of flow of anger into striated muscles, hands and legs, because it is obstructed by reality and morality and social conditioning, the affect is flowing, the anger is flowing into different directions, causing problems. So it can flow onto oneself, leading to depression. It can move into the body to create psychosomatic difficulties. And the whole idea is to be an emotional plumber and declog the natural pipelines, so anger can flow into the natural pipelines, which are the pipelines of striated muscles. In one sense, The work of ISTDP therapist is that of an emotional plumber. Declog the clogged pipelines for the flow of affect. And the clogging is often because of anxiety or because of defenses. In that sense, ISTDP is primarily an act of emotional plumbing followed by restructuring. Then, how long are ISTDP therapy sessions? The first session usually is of 3 hours. Thereafter, some people use a 1 hour session. Some people use 1.5 hour session. Some people use a 2 hour session. Most common is the 1 hour session. 1 hour session once a week. That is most common. Some use 3 hours per week, once a week. That's also very common. Usually frequency is kept to 1 session per week. Very few people use more than 1 session because what has been stirred in the session needs some time to settle down. And too many sessions per week can create counterproductive difficulties for some patients. It is safe to have 1 session per week, either of 1 hour or 1.5 hours, in some cases even 3 hours. 11. Does ISTDP therapy happen lying on the couch? How long does it go on? No, it is ISTDP is not on the couch. It is face-to-face, video recorded, and it goes on anywhere from, for mild cases, 5 sessions, mild to moderate 50 to 25, and deep-seated cases, fragile cases up to 150. Are all ISTDP sessions video recorded? Yes, they are. What if the patient says he is not comfortable? Depends on the therapist. Some therapists believe that the method should be followed to its purity and T, and they tell the patient it's a take it or leave it situation. If he wants ISTDP, he has to allow video recording. If he cannot give consent, he cannot, the therapist won't be able to offer him ISTDP services. Some therapists are more liberal. They are fine with the patient's insecurity, so they don't do video recording. Some find the middle route. They don't video record all sessions, but with patient's permission, occasionally record a session for supervision so that the therapy can be accelerated. 13. What is murderous and torturous rage? Davanloo states that there is a line of events in childhood. We are beings of desire, love, and attachment. So we move towards our parents with love and attachment, expecting the same. We also move towards our parents with desires that they should satisfy. If our desires are frustrated or our movement of love and attachment towards the parent is not reciprocated adequately, we develop rage towards the parents, which is murderous rage and torturous rage. Murderous rage is to kill the parent. Torturous rage is to torture the parent. Most often, both of them coexist. We want to kill after torturing. This is not acceptable to our morality and therefore is completely repressed and therefore is outside of our awareness and control. It is generated also outside of our awareness and control most of the times. Because we harbor such ideas and feelings, there is a guilt in us. And this guilt, because we love the same parents and we also see they are doing so much for us, even if they cannot satisfy all our desires. So, because of this ambivalence towards the parents, there is intense guilt. And the guilt in turn creates a secondary rage to punish ourselves, and this guilt sabotages our life in professional area, personal area, often can also lead to some accidents. Usually, torturous rage is more deeply repressed than the murderous rage, but not necessarily always. In some cases, you can have torturous rage on the surface and murderous rage coming after that. What is guilt and destructive behavior according to ISTDP? The presence of murderous and torturous rage creates guilt, and the guilt punishes oneself. The nature of guilt is, if you feel it fully in the body and let it go, you are free from it. But if you don't feel the guilt fully in the body, it's very uncomfortable to feel. Guilt is one of the most uncomfortable feelings to feel, even more uncomfortable than anxiety, even more uncomfortable than envy. And if you are not ready to feel it because of being so unpalatable, so unpleasant, then this guilt becomes self-destructive and punishes oneself. So the nature of the guilt is either you feel it fully and let it go, or be ready for punishment of guilt, which is self-sabotage in all areas of life. It can also be psychosomatic sicknesses. It can also be unconsciously invited or caused accidents. Fifteen, what is feeling as it is dealt with in therapy? Usually we say I am angry. We use the word anger. We use the word I am angry, but we don't really feel it in our body somatically. And this somatic aspect of the affect always eludes us. And therefore, complete catharsis from its roots does not happen, because the affect is also rooted in the biological system. So when the ISTDP therapist says feel it, he means feel it fully along with its biological sensations, its biological roots. And that is what is called feeling the feelings in therapy. Let us stop for a cup of tea. In the second part, I will deal with remaining questions of this chapter. Thank you.